Hi everyone, this is David with KnowStroke. I had gotten away from sort of the weekly updates on our newsletter, but I wanted to just do a quick summary of the week that was. It was very busy around the topic of wearables and using technology to better engage and help monitor and plan for aftercare and recoveries for stroke survivorship. And, it's a topic that I'm writing about in my upcoming new book, Closure After Stroke. But it's something going back to the beginnings, even before my own stroke recovery, and using these tools that I've been very motivated behind, because these tools can motivate patients, and they can actually help make meaningful change. And the things that I want to call out, we all have to get involved in, as I referenced in an article I wrote last week that I'll reference in this video. I'm involved in a study right now that you all can get involved with out of the University of Vermont. And the study is involving trying to pair or using existing clinical grade sensors to be able to help validate and maybe state a case in use for the potential for the Apple Watch to help track and monitor improvements in gait, but also potential beyond that to help in stroke recovery. I've always used my own watch, so now this is day two of the study for me. And I just wanted to say I'm not going to, I happen to, the one you can see, I'm using a polar heart rate monitor. I have a sensor, ActivePal. A lot of these are already clinical grade and proven, sort of gold standard for treating and tracking, gait parameters and actual steps and other things. But I'm going to link to the study, but this is kind of where I'm wearing all these these wearables now, and will continue to do for the to finish week one, and then we'll go beyond that to pair off a few less sensors, but then continue to track for a second week. So, if you guys, I've in my journey in recovery, I've written, talked about, early days when we used CalTrack to actually motivate employees in a corporate setting to move more to wearable sensors that I've used with pro athletes in sport performance to engage and help track recovery remotely. So, like, these things are not new, but unfortunately, it's been they've been late to the game, getting to the stroke recovery and stroke population. So I wanted to call out that study. I'll link to from this video to how you can get involved. We need more survivor input. If we don't do that, we are not going to be able to innovate and see change that we all want and need. So we'll be doomed to fail. So, to this point, in the week that passed, I was in several, journal clubs, and I try to spend my lunchtime meetings productively in learning. And this one was put on by a Digital Medicine Society. And it really struck me because they were talking about the potential for digital and how it can help direct and recruit more individuals. And it was perfect timing because as I was paired up with these sensors, what I learned from that meeting was that 85% of clinical trials fail to retain enough patients. One. Two, 30% is the average dropout rate across all clinical trials. Greater than 66% of sites fail to recruit a single patient. And I'm writing about this because I had similar, effect in a trial that I was part of at the University of Rhode Island. And 50% of site enrollment in one or no patients. So they enroll one or no patients in their studies. And that was a company called Metadata that was highlighting sort of how wearables and their particular product, I think it's the BioStamp, could help, collect data and more meaningful, give, reference data that is most helpful for those actionable insights and, the real world mobility, as we call it, as opposed to one point in time measurement in the clinic. that's that study, and with that, we had some great interviews with folks that are trying to do better in stroke. And one is Gary Viles. If you happen to listen to that episode 84, I point you to that, because I asked him on that, along with my co-host Mike Garrow, what his potential, what he thought, what digital health and wearables could do. So his response was quite insightful, and it really talked to the power of what he feels it can do to motivate patients. And it can help on the reimbursement side, and his whole product line could benefit, but he's actually seen how these things can help kind of turn that light bulb on. That's kind of why I think we connected so well around the Tony Stark movement, and what we need to do better for stroke, and for any individuals that are affected from neurological disorders where technology can help. I want to point out that was a great episode. We have many more coming into the fall, but there was some good feedback on the chime in on the show notes from our KnowStroke podcast, and I just want to read this because it's now up on our fan page. But thanks to our last episode with Gary Viles, I appreciate being able to take these interviews with me while driving and learn about new rehab technologies that can help patients in their homes. And again, it was sent by Lauren B, who gave me permission. She put it on our contact form and I posted it. I know she's a home health physical therapist. So thank you for that. And then, the article that I wrote around when will stroke care get its breakout moment, I posted that both to LinkedIn and Substack. I posted that in response to the great interview and case study I did with stroke survivor Rory Polera, and I really hope that more stroke survivors and care partners get involved in that conversation, because that's what it's going to take. And in fact, on LinkedIn, Jennifer Brown, who's going to be a guest, already recorded her session, but just trying to find time to do the intro and get her session out. She's also a great physical therapist doing great work in the community. And she says, I see so much about wearable sensors. So she gave feedback to that article that I posted. And will the wearable sensor be worn on the hemi side, less affected extremity, with less on the affected side, it will move more and not be accurate. And she goes on to describe, that we need to do more and get engaged. And that's exactly why I'm doing this, Jennifer. And that's why I have been doing it with all the technology I've worked with over the years, and where we are now at a point in time where, we are at that Tony Stark moment where the potential is there. It's, with the overlay of AI, we can make a lot of these things more affordable and more engaging and more effective for the patient. And so we have to get involved, go chime into Rory's interview and case study. And I'll leave with this. Last week also, I jumped in to the relatively newly formed Center for Health Technology, and that was midweek. I happened to catch it on a lunchtime webinar. And what my point is, I asked in that at the Q&A, there was a lot of talk about other conditions and how we're improving, and it just happened that stroke came up. So I posed a question, like, with stroke now being a worldwide problem and something that we all need to work to solve for, I asked the same question that I wrote in the article, is like, when are we going to get that breakout moment in stroke? And it was very interesting. I'm going to follow up with an article about it, but basically all those leaders, all those experts in the room really didn't really have an answer. I'll find the replay and I'll post my question here as well that I asked, because I don't remember it off the top of my head verbatim, but it was really telling that we have so much more we need to do around advocacy and being empowered, but patient-led empowerment. You heard it in Gary's interview where he talks about like loving engineers and loving the work they do in the lab, and they're brilliant minds, but a lot of times what they're working on has no implications on the clinical side because they don't understand the workflow. So folks like Jenna Fay who commented, folks that have commented about good and bad, what they see potential for wearables that are stroke survivors in the Substack community. We want to hear more from you. But I'm just going to leave it at that. Is without your input and advocacy, our efforts are going to be silenced. So there is one webinar coming up that you can get involved with, and it's by the World Stroke Organization. So I don't have the link and the title for it, but I know I signed up. I might have to catch the replay, or I might move my schedule around, but it's about initiatives and getting more patients involved and setting the stage for what those things need to be that we need to take action on. So without us all getting involved, and maybe we continue to try to build a bigger community here on Substack where it's free and you can easily record things like this and talk about your pain points. But I have to go start my day. I ask you to kind of comment here and continue to comment, chime in on the podcast link. That feedback empowers us and helps us guide what we do next, and also directs us what you want to hear more of. So get involved in the study. It's not hard. The data that they're collecting is de-identified. You're not being singled out, and if anything, hopefully it can help you learn and help us grow. I know they're about 50% full in recruiting, but they need more, and it's quite easy. I've already been empowered and being moved by the analytics in the Apple Watch, and what we heard in Rory's and my showcase of his study, his story, is that it does work. We want it to work for more folks that need that nudge and movement and don't have the power and potential of knowing or having access to these great tools and technology, because they're not expensive now. But we need to unite to try to get everyone on the same page so we know what we're asking. And just like I mentioned at the title of this video, you can't manage what you are not measuring. So let's start measuring. Let's start working together. Have a great day.